This is Mary. She has a recent diagnosis of recurrent respiratory papilloma and really working on counseling to educate her about respiration, voice, and so I have a long-term goal of that she will increase awareness of normal speech and breathing. First session goal is given a tactile cue and shown a model. Mary will differentiate between inhalation and exhalation with 80% accuracy in 3 consecutive trials. And given a verbal prompt and visual cues, Mary will identify components of respiration with 80% accuracy in 3 consecutive trials. Okay, Mary, so we just finished watching that video clip about breathing in and breathing out, right? Do you remember the word that we call, that we say for breathing in?
Inhaling.
Very good. And what about breathing out?
Exhaling.
Great. So what I want you to do is to feel the difference. So when you put your hand on your stomach and when you take a really deep breath in and you feel that tightness in your stomach, that's your diaphragm. Now breathe all the way out until you can't feel any more. Okay? And you see the difference? When you inhale, your chest expands, right? And when you exhale, it gets smaller. And so we have a little model here, and this is like our chest cavity. And here is our trachea, remember the other word for the windpipe. These 2 branches of the straws, those are like your bronchi. And then we have the 2 balloons are like your lungs. And this right here is that sheet-like muscle that we call the diaphragm that helps us to breathe in and out. So if you watch here, we're going to pull down, and that's exactly when you inhale, you pull the diaphragm down and the lungs get bigger. You see that? And they fill with air. And then when you exhale, the air goes out and the diaphragm pushes up to help get all the rest of that air out. Okay? So I just want to put your hand on your stomach again and let's just practice breathing in and breathing out a few times, okay? And then when I'm going to ask you which one it is every few, so let's just start together. Breathe in, breathe out. Breathe in, breathe out. And what's that called when we breathe out?
Exhale.
Very good. And breathe in. And what's that called?
Inhale.
Very good. Okay, so what I have here is this skeleton, and I was going with a little Halloween theme. So we have this skeleton, and we're going to see if you can remember some of those parts that we talked about after we watched that movie, okay? So, do you remember another name for windpipe?
Trachea.
Very good. And remember, these 2 branched out, though, do you remember what we call those? It starts with a B. It's the bronchi. Okay? And then these little branches out, those are our bronchioli, and those, remember, attached to the alveoli, which are the little air sacs. So do you know where this would go on the skeleton? Very good. Okay, so then, what's the big muscle that is down here that helps us to breathe in and out?
This one.
Do you remember what it's called?
The diaphragm.
Very good. So we'll put that right there. Okay, what 2 things do we use to breathe in and out?
The nose and the mouth.
Very good. You go ahead and put them on. Okay, do you remember which lung is shaped a little differently?
This one.
And
right
which,
one.
the right one, and why is it shaped a little differently?
Because it leaves room for the heart.
Very good. Go ahead and put that where you think that would go. Very good. And what do we have left?
The left one.
Very good. Okay, so now, let's see. Take that. Well, actually, why don't you put them all back on and try to name each one.
Trachea for the windpipe.
Very good.
The right lung. The diaphragm. The mouth. The nose. And the left lung.
Very good. All right, and so I have one more little activity, so we'll use this as a guide. We've got another skeleton here, and I thought we could use Play-Doh to try and make little models of them, of the organs that we use for breathing, and we can stick them right onto the skeleton. All right, so I think we've got 2 here, and then there should be some more Play-Doh down there. I'll let you pick your colors. All right, so first we want to make a nose. So, you know, try to make, it's got to be just to fit on there. Okay, and what other thing do we use to breathe?
The mouth.
Good, so let's make one of those. Okay, and what comes next?
The diaphragm.
Okay, we can make the diaphragm. And which one was that again? Point to me, or point on there. Very good. We can kind of cram it here. Oh, very close, but that's on top of the pelvis. So remember, we want to, it goes right by the lungs. Okay, right underneath, because so you can see that's what helps push up and get the air out of your chest. Okay, so now I think we need, what do we find right here?
The windpipe.
And another name for that is, starts with a T. It's the trachea. Okay, good. So, and that's just going to be this long portion, and then we need 2 branches for the bronchi. Very good. And now we just need...
The left lung and the right lung.
Yep. Looks right about perfect size, too. Very good. See, we have our working model of respiration. Very good. Okay, so I'll let you bring this home and you can keep this as a visual reminder. I'll hang on to this and we'll check again for next session. And I'll have you rewatch that video again just to make sure that we remember how everything works together, okay? And so I'll see you next time. Great job today.